Next question, the member for Orleans.
Thank you very much, Mr. Speaker. My question's for the Premier. Mr. Speaker, medical experts are becoming increasingly concerned, with one going so far as saying that the lagging indicators are now flashing brightly. In Ottawa, there are 17 active school outbreaks and 3 outbreaks in childcare centres. That's over 120 active cases in our schools, Mr. Speaker. That's 1/4 of all active cases in Ottawa. And the trend is only going in the wrong direction. Instead of simply using our schools as a vaccination staging ground, the government is forcing parents to register their children one at a time. It's very inconvenient, often inequitable. At every turn, Mr. Speaker, the government takes the slower, more inconvenient process to protect our families and our kids. They're failing to take proactive measures to curb the spread of COVID-19, and it's starting to show once again. We need to accelerate third dose eligibility. We need pervasive, free, rapid testing, and we need to invest in better ventilation in our classrooms for our kids that are going back to school. So why, after almost 2 years of dealing with this pandemic, is the government always choosing the slowest, most reactive, most inconvenient, and often most inequitable approach to managing the pandemic in our communities?
Of Education.
Thank you very much, Mr. Speaker. You know, I think one of the great strengths in Ontario is that we have one of the highest vaccination rates for youth in the country. For high school students 12 to 17, we have over 80% double vaccinated. We are literally one of the highest vaccinated provinces in the country. That is because we've launched over 600 school-based clinics for children aged 5 to 11. There are well over 400 school-based vaccination clinics as we speak. Roughly 1 in 5 children have already received their first dose. That is incredible progress. I appreciate there's more to do, which is precisely why the government is expanding access to vaccinations. It's why we've improved ventilation in every publicly funded school. 70,000 HEPA units, mechanical ventilation improved across the board. It's precisely why we continue to invest with expansion of testing, as I noted earlier, the take-home PCR test to make life a bit easier for those parents, as well as providing on a proactive, preventative basis rapid tests for all families so that our kids can get back to class in January as safe as possible.
Thank you, Mr. Speaker. 1/4 of all active cases in Ottawa are in our schools. 1/4 of all active cases in our schools. If you remember last December, Mr. Speaker, cases were on the rise, and the government was also waffling on implementing public health measures ahead of Christmas. They weren't sure what to do then. It doesn't seem to be that they're sure what to do now. We know that they forced small businesses closed while keeping big box stores open with very poor distancing. We don't know what they're going to do as we approach the holidays this year. Fast forward to this year, cases are on the rise, ICUs are moving patients between hospitals, and things are going in the wrong direction. We have a variant of concern that's spreading across the province, and the government is once again waffling on public health measures. Are we taking them out? Are we not taking them out? Are we setting artificial deadlines to provide false hope? What exactly are we doing? The government doesn't seem to know. This is a constant refrain from this government. Poor communications, mixed messaging, sending false signals to the public. When is the government finally going to be clear with people?
I ask the member to withdraw.
Pardon me, I withdraw, Mr. Speaker.
Question's been posed. Minister of Health.
Speaker. In fact, we have been very clear with the people of Ontario since the beginning of this pandemic. Most recently with our fall preparedness plan and with our plan to reopen Ontario, we indicated when we would be moving to certain stations, the anticipated time, but always with the caveat that if there was a change in circumstances such as a new variant, which was highly transmissible, very virulent, and resistant to vaccines, then we would have to reconsider that. Right now, we're in the position where continuing to vaccinate as many people as possible with a very high success rate, but we need to have that additional information in order to be able to make the final determination about what happens in January. We're just at the beginning of December now. So we are expecting to receive that information very shortly. But I can also advise that we have 162 people in intensive care right now. The numbers are still quite low. Any transfers that are happening are not in the same state as what happened before. There are always patient transfers from one hospital to another. There's nothing new in that. That has always been and always will be. But Dr.
Thank you.